Hi, welcome to Simply a Social Worker. Welcome to part two of the video that I started the other day. I wanted to extend an apology. I went so quickly with the last video. I wanted to get the information out so that you all could hear it. I wanted to give a little bit of background about me. I have a doctorate in clinical and pastoral counseling. I have my master's in medical social work, and I've done case management almost 30 years. So that's a little bit about me. My main goal and emphasis is to really just give information out to my fellow veterans. I'm also a war veteran, so I like to make sure that people that I get to serve in the community that they have the information that's being released all the time. So this is my way to do that. So in the last video, I talked about how to apply. So this is the Medicaid.gov section. So if you go up here, you can go to Medicaid.gov and scroll down and it says learn how to apply for coverage. You can click on that. And please feel free when you get to this website to just explore. In every website, they have tons of information. Some of it can be overwhelming. I always recommend to just look into one program every time you go on the website. Don't overwhelm yourself. If your thing is Medicaid, look at Medicaid. If you prefer the CHIP program or looking at the basic health programs, look at that. And also checking out what's going on in your state. So that's the main thing. Um, Also, just know that you can look at this information on the website or you can call a representative. If you decide to call a representative, create a checklist. I know I probably said that in the last video, and you're thinking, why would I create a checklist? I know what to ask. Most people, when they get on the phone with the representative, they will ask one or two things and forget to ask the main thing. So if you're going to call, decide how you're going to create a checklist. If you have chronic illnesses in your family, write that down. If you are just a single person, you don't have any chronic illnesses, you go to the doctor annually, you go to the eye doctor every other year, you don't need that on your plan, maybe you go to the dentist once a year instead of twice a year, whatever your needs are, write that on your checklist because it'll make the phone call comprehensive. It'll go by a lot faster. You'll get the questions you need answered, or they can connect you to the person that can answer your questions. And then oftentimes people forget that they may have surgeries coming up, or unfortunately, they're a caregiver. Not unfortunately, I don't mean to say that. I just mean sometimes we're a caregiver and forget to ask the needs of those we're caring for. If you have a child with autism, if you have a parent that you're assisting or an aunt, we forget their needs, but we handle, all of their medical concerns and we go to the doctor with them. So this is a way that you can get all the information you need when you have the representative on the phone. Last thing about that representative, when you're calling any of these government agencies, try to call first thing in the morning. And you're probably thinking, I know that. People forget the first thing in the morning, people are available. As you wait in the middle of the day toward the end of the day, that wait time it takes a while. And so, just to save yourself some headache and maybe some frustration, try to call first thing in the morning when these offices are open. So, with that being stated, create your checklist, put everything that you need or the one that you're caring for may need, and then if you decide to call, you can do that. You can get the phone number on the website. So this is the map. If you scroll down with the page at the very top, if you remember, let's see, just so you know what page to be on, it'll say, where can people get help with Medicaid and CHIP? Okay. In this video, we're going to be talking about Medicaid only. I'll talk about CHIP in the next video, and it will say part 3 for the information on CHIP. But this one is strictly Medicaid. So you scroll down. If you want to do the drop down for your state, fine. If not, you can click on the state and once you click on the state, that information will come up, eligibility, enrollment. And I will tell you, California is just really different. Every state is, But I found the larger states, they have different names for their programs. They have community partners that they deal with. They have third party agencies that they deal with. So you may think, oh, okay, I'm just going to do Medicaid, not knowing that they have different names under Medicaid. So consider that. So when you pull up these states, especially like California, Texas, Alaska, the larger states, Arizona, you'll find that the larger the state is, the more third party agencies they deal with. Still under Medicaid, but they just have a different name. Consider that before you start calling places, just consider they have different names. Okay, so I will pull up California first. So here's California. I'm going to look at the eligibility and the enrollment. Most of the enrollment, if you do it online, just know you will have to create an account. Some people do not like to do all that. They just, I don't want to create an account. I don't need to try to remember all this again. And they call, which is fine. But know if you call, it's going to be a bit of a line. So if you see the phone number when you pull it up online, you'll see the phone number. And I highly recommend you just to put it in your phone. Just put it in your phone. It's going to be something you'll need at least for the first 6 months of having any new plan. And as you notice, you may not on the screen, I'll scroll up. California is called Department of Healthcare Services. Just below that, Colorado is called Health First Colorado. Just so you're aware, they have different names, still Medicaid, just different names, excuse me, different names. So I'll click on the eligibility. Just taking a few minutes. Come on. Okay, just so you're aware, look at all the different names for California, like Medi-Cal and Covered CA. It's just, but it's under the Affordable Care Act. You wouldn't even know that, but it's just people forget that California is huge, and so to provide services, they have to maybe have, other partners, other beneficiaries that they deal with. So just bear that in mind. Think about what you're applying for and the name still under Medicaid. So so that you're aware, they partner with Covered California. Like I said, everybody is different. They have different partners still under Medicaid. Okay. You can go to your frequently asked questions. You can do your forms, your local offices. All right, so I'm going to scroll up to the top because as you can see right here, application for health insurance, including Medi-Cal. Okay. And then we're going to go over to Medi-Cal for families premium payments. Hopefully they'll be able to give just some updates and see how much things are costing there. Okay, the online application. You can start right here. Once you've compared health insurance options, you decide on the plan that's right for you. It's time to apply. So I'm going to pull this up. This is again for California, and you will see all of them are so different. But once you go on your state, you will know what to look for. I always tell people look up the eligibility because as your income changes, so will the plan that you are eligible for will change. Some plans are just low income. You don't have to worry about income. But as you go through the different programs, you want to make sure it doesn't matter your income, it doesn't matter how many in your family. If this is a plan for single people, no chronic illnesses, this will be my cost. These are things people just forget to ask because you just want a health plan that works for you. This is going to be a dummy account. I don't know if it will let me, but I always try to, just do a dummy account. I'm not going to be dishonest. I'm just going to make up a dummy account for California to kind of see if you're able to do it. So I will come up with one for California, a zip code for California. So give me a second. I have to um, come up with the zip code for California. Uh, I always pick different ones. I don't go by the same one all the time. Let's see. Hmm, Okay. Let's just say I make, I don't know. Let's just say 30,000. Well, no, let's just go 40,000. Let's see. How many people are in your household? Let's just say it's just, I don't want to say my husband, and one child. Let's say three people. Then you enter the age. Again, this is just a dummy one. I don't want to be dishonest, but I want to just kind of give you, you know, um, an idea. Needs for coverage. And then I don't want to go too far. Head of household, age, head of household. Let's just say 40, just so you'll have an idea. Let's see. I'm gonna go all the way to the bottom. Age of person number two. Husband is 42. Age of person number three. As you can see, you have to give each age. And then let's just say my son is, I don't know, 13. And over here, if you look on the right of the screen, where it says needs for coverage, if you hover over right here, if you're pregnant, it'll show you select this option if anyone in your family is expecting or need a special program. So you would select that, and then you hover over here. It'll say select this option if one is disabled or blind. So if you say, Sonetta, what does disabled mean? Because there's different categories. So I will say this, if you have been diagnosed as disabled, I have to say it like that because if not, then you get all of these other variables. So if you've been diagnosed as disabled in any way, you would click that one. Okay. So as you can see, all of this is coverage for all of the three people. As you can see, head of household, person two, 42, and that's a coverage for them, and 13-year-old coverage. Okay, so see my results. You click on that. This pop-up came. It says this is just a quick check to tell you if you might qualify for covered California or Medi-Cal or other health programs covered by the state of California. We ask for only basic information to tell you if you might qualify. The coverage application itself asks for more details, so you are aware of that. I know you guys can read. I wasn't, I just wanted to kind of let you know what the pop up says. And this will be almost for every state. You will get a pop up. It's just a preliminary eligibility to let you know what you're eligible for based on the basic information they got from me. Okay. Um, as you can see, this is the only way to know for sure is to apply. You can do this at any time. And I will tell you, most applications, depending on how many are in your household, that's how long it'll take. If it is 4 or 5 people, just plan to do 45 minutes, 30 to 45 minutes. And I say that because the basic information, address and all of that, that will not change. It's the details. If you have chronic illnesses, if you will go to the doctor more, if the household income changes between you and your husband, whatever that information is, if you have, multiple children, if they have illnesses, that's the reason it'll take, a little bit more time. Okay. So as you can see, it says if you qualify for a special enrollment period, you can enroll outside of the yearly enrollment period. Again, this is just for California, just so you're aware. All right, so this is the program. This is how it should look. I just want you to know. Here is what I told them at the top. Okay. This is the information you'll see on the preliminary form. Based on what I've told them, this is what I qualify for. California covered programs, lower monthly premiums, and then I click here for more information. Give me a second. Okay, I'll go back to that screen. I'm just trying to, it's not letting me, it's taking its time. Sorry about that. Okay, it's not letting me go back. one second. Okay, it's trying to make me sign up for something, and I will not. Just one second. Okay, for some reason it would not allow me to look at it that way. So I want to preview the plan for me and my husband right here. It says preview plans. Give me a second. Okay, if you scroll down, it kind of shows you what level of care will work best for group one. And it actually shows you low use. That just means, you know, you don't go to the doctor that much, and if you need to, you'll get a test and a service. Medium use, 4 or 5 times a year. That includes test and treatment. High use, this is primarily for those that have chronic illnesses. Very high use. What level of prescription use? If you don't need prescription, so you would get this one here, you would pick low use. Okay, so just consider, as I said earlier, looking at your family. What are your needs? And this kind of gives you an idea what you can put on that checklist. Little to no prescriptions per year for you. You're young, you're 30, you go to the doctor once a year, you rarely get under the weather. You would pick one doctor visit, test, preventive services two. You could pick that. And then you go right here. You would pick low use. And then if you don't ever get prescriptions, like you're good to go. You wouldn't have to pick that. That's up to you. Then you hit next. Again, I'm talking about relatively young. But again, this is based on the couple. So this is again based on the couple for like the two members. If you look at the top, this is based on us. I don't want to make this video too long, so I just wanted to show you a lower premium monthly cost with higher costs when you get recommended with fewer care concerns. That would be the one um, we would pick because we have fewer health needs. Low use for the doctor once maybe, just for your annuals. And then we rarely get prescriptions. And to be quite frank, being military, all of that is covered for us. But again, I like to just do it based on, we don't go. We don't really have prescriptions and things like that. And then you go to the next one. And then here you enter the provider's name and that type of information. So I'm going to put um, Dr. Stevens. I'm making that up. No provider available. Okay. Let me do a Dr. Brown. And again, this is just, you could put any name. You don't have to. This is just to look up the information. Hopefully it'll let me go through. Okay. So by using Covered California, you'll save $831 a month. That's still very, very high. Your estimated yearly savings include. So if you look at these, this is just us, our plan, and it's a silver tier plan. If you look over on the left, okay, if we decide to go this way, LA Silver plan here, this one here. Primary copay is $15. Generic prescription, if we decide to go with this plan, is $8 every prescription. Yearly deductible, 1,400 if we go in the hospital. Estimated yearly cost, $503. Of course, every plan will be different. This is because we have low care needs. This is for us if we have low care needs. And then you have the Kaiser Bronze if you decide to go that way. Um, Copays are 60, generic prescription. This is a little bit more costly. It's $20. Yearly cost $553. So it actually kind of gives you an idea. And then if you look over here to the far, far left, these insurance companies, you have Molina, you have Blue Cross Blue Shield, you have Anthem Health, you have Kaiser. So all of these, depending on, what your preference is. Blue Cross Blue Shield is going to be more expensive. That's just It's called Blue California there, but it's Blue Cross Blue Shield for most people. If you notice, they're very expensive. Their estimated yearly cost is 6,000, and the copay is $60 every doctor visit. Then if you look at Anthem, I'll take that off so you can see Anthem. Theirs is not as expensive. It's $15 for every copay. Generic prescriptions. Again, this is very basic for those that have chronic illnesses. If you know you have a chronic illness, you know that you're going to spend more. And I am saying please write down your chronic illnesses because it factors into how often you go to the doctor, and if you go into the doctor for heart disease, you're going to the doctor for seeing a uh, nephrologist for your kidneys, you have several chronic concerns, you're seeing, different specialists, you are going to spend more. So you want to try to get the best plan for your money. So consider that. We're a little bit over than I wanted to cover for the video. I did not want to make this long. I wanted to go through the process with you all. So if you are looking for a Medicaid plan, you know that it's available. I just happened to do a California one. You guys could look at any one you want to do. I did the dummy plan. When I say dummy plan, I just mean one that I made up the information just to kind of give you an idea of how the plans work, how long it takes you to apply, depending on how many are in your family, what the needs are. So we've been doing this video, give or take about 15 minutes, and me doing a little ad lib, about 15 to 18 minutes. And so consider that as your time frame. If you have chronic illnesses, it's going to take you a little bit longer to get these numbers online. If you call someone, it's going to take you longer. Write down your information, have everything you need. If you decide to apply online, have your ID card, of course, your social security number, all of those things. Have your pertinent information right next to the computer or your phone if you decide to do it online. And hopefully, this video was a help to you. And thank you for listening to Simply a Social Worker. And I'll see you in part 3 in the next video. Thanks. Bye.